I'm thrilled to have Dr. Danielle joining me today. Dr. Danielle is dedicated professional specializing in chiropractic care and neuro-emotional techniques. She is known for her holistic approach to health, focusing on spinal health to naturally improve overall well-being. Dr. Danielle is passionate about providing optimal health and wellness for both humans and animals. Hello.
Hey.
I'm very glad you could join us today with your busy schedule. So, can you share a little bit about your background and what led you to do what you do?
Yeah, absolutely. So I'm a chiropractor. I always say that it chose me. I did not choose it. I feel truly blessed by that. It was the horses which led me into it. A long story through animal chiropractic. So I ended up going to chiropractic school, got that degree, and then as a human doctor of chiropractic, it was actually kind of through the horses that I also ended up in functional neurology and functional medicine, funny enough.
Oh, wow. And do you own a horse?
I have owned horses most of my life. At the moment, I don't, but I did grow up riding horses and barrel racing and rodeoing. Yeah.
Oh, wow. That's amazing. And how did you get to come across mold toxicity?
Yes. So that's where the whole story lives. So I had graduated chiropractic school. I was practicing. I think I'd been practicing for probably about a year. I was riding horses and rodeoing. I had gotten bucked off, just the horse life. A few unfortunate incidences basically back to back, and I had suffered a couple, which I didn't really realize at the time, but were significant concussions.
Oh,
And then within that time period, again, not knowing, I actually moved into a house that I was renting. And I ended up finding out it was full of black mold. But again, I did not know at the time. So I had a few concussions, moved into that house. And then within probably 3 weeks to a month, all of a sudden I came back from a vacation and I gotten really sick. I felt awful. And then I got a quick onset of vertigo to the point of where like it was hard to even stand up and treat patients and adjust them. To the point where I was so sick, I was getting sick every day. So that continued on. I was just, I didn't really know what to do about it. I was trying to push through, but it was affecting basically my quality of life and care of other people at that point. And then amongst and through all that, like I have never really suffered from anxiety or anything. I was having like unrelenting like panic attacks out of nowhere for, no seeming reason. So it led me down the path basically to searching for answers. And in that time, I had actually ran across the group which I trained with for the functional neurology. It was Dr. Malillo at first, and then Brandon and Kyle. And so I kind of got hooked with that, and I started attending the Malillo seminar and those courses and learning functional neurology. And then so through all that, I got connected with that group of doctors. And then it kind of took me down a functional medicine path as well, basically to get answers for myself of what was going on.
mhm.
So through functional neurology and then through functional medicine and different testing, which I'll talk about, I basically got all the answers to what was going on with my health, rehabbed it, fixed it myself. And so that way now I can share it with others.
Oh, wow. And what are the main risk factors with mold toxicity?
So mold toxicity, it's kind of, it can be like very loud. Some people are very aware, but it also can be very like a silent, hidden thing that people don't understand of what's going on with their health. So anytime like chronic immune patients that they're always sick, they're catching everything. I tend to kind of think mold. Your obvious things like your respiratory and your sinus issues
Mhm.
that can definitely be linked to mold toxicity, chronic pain and fatigue, brain fog, sleep disturbances, anxiety, depression, neurological decline. I all kind of starts triggering my mind of is it mold or what type of toxicity are we dealing with or infection?
Mhm. And with children with developmental issues, what would be the first signs of mold?
Yeah, so that's definitely so working with a lot of kids too and doing a lot of functional neurology work and working on integrating primitive reflexes because I really was kind of just doing all of that before I really got into the realm of that more like mold and functional medicine. And it was like you'd see improvement and you'd see all the right reflexes integrate, basically, go away, go back to normal. And then you'd check them again in a few weeks or, a month, and they were all back. And I was like, what, something's missing. What's going on? Why won't they stay? So it's just like if you've been working and working and working and you see improvement and then you see fallback, or you're not really getting anywhere, that's when typically you need to dig deeper and look at, is it a mold issue or what's going on in the gut, parasites, whatnot.
Uh-huh. And I know you also test remotely. So how can you do it for mold?
I do. So I practice applied kinesiology and muscle testing, obviously in person. I do it remotely. I have a cell core, so I love working with cell core biosciences. They have a great just detox regimen, and they actually have a like test vial kit, a muscle testing kit. So through working with people from a distance, once I get in connection, get to know them a little bit, I can actually muscle test them virtually or from a distance and pick up on basically what issues are going on. Mold does happen to be in that test kit, as well as other infections, parasites as
Uh-huh.
well.
So with remotely with kids, would you be working with the kid, mom? How
The whole
does it work?
family, all of it. Yes. So yes, I can work with the kid, I can work with the mom, the whole family. Like I said, even in person, the way I typically test kids would be through a surrogate. So I'd use,
Mhm.
an adult, a mom. Or
Yes, yes. And also online, especially like if the kid's not cooperating. So you'd do it through the mom, right?
absolutely, yes. And you can do it face to face, or I can even do it non face to face.
And how could we prevent having mold in our homes?
Preventing having mold in your home. So that's a loaded question for sure. So windowsills are always like hidden, like your obvious sources. So carpet, of course, if you've had any water damage, that's going to hold mold. Behind walls. The house that I was living in, it was growing behind the walls and basically the drywall. It was
Mhm.
older. So there's a really good test company that I've found, and it's pretty easy and cost friendly to get tested. And it's called Immunolytics. But they send you a test kit based upon how big your house is, square footage, and how many rooms with specific instructions. You can actually swab it, and you grow it on a piece, you send it back to them, and they'll test what types of mold and what levels. And then they also offer you solutions for remediation. So
Mhm.
that's just a good get to know if if you're living in mold or if you have mold. But prevention is just paying attention. So like old carpeting, windowsills, actually like appliances. So dishwashers, front loading washing machines are really hard to keep mold free as well. There are air purifiers, of course, are wonderful. There's actually a thing called air scrubbers, which just clean the quality of the air. There's another product. It's actually a spray, and it's like a probiotic spray you can spray in your house, which helps prevent mold as well.
Mhm.
So being aware, first of all, looking for it, and then if you don't have it, there are things that you can do to help prevent and help air quality.
And what were the main challenges you came across when treating mold?
Yeah, so basically, so biggest challenge, and especially in kids, is it's hard to heal in the environment that you got sick in. So a lot of people are living in mold, and they're insistent that they don't have mold in their house. So that's when I'm like, please test, and then they normally find out. So you have to clear up the environment. So either the house, also with kids, it's super common that there's a lot of mold in schools. So figuring out if they're constantly, every day being exposed in that way. And then just other like churches are oftentimes moldy. So it's really just paying attention to your environment and trying to remove yourself as much from the sick environment. And then another battle or encounter I would say is you have to, and that's why I love using the applied kinesiology and the muscle testing, is
Mhm.
to work with somebody's tolerance. Like you need to be able to detox whatever the mold, whatever issue you're trying to, but it's important to build your body up strong enough and open up your drainage and your detox pathways, so that way you're not going to have a huge Herx reaction, and that your body can actually tolerate it.
Uh-huh. And all this can be done online, right?
Absolutely, 100%.
Oh, wow. So, Dr. Danielle, how can people contact you?
So I have my website up and going. So Dr. Danielle, so Dr. my name, DanielleBarron.com. And there is an inquiry in there, a new patient inquiry, and just fill that out, and I'll get the email and get back in touch with you.
Oh, great. Thank you so much for your time and knowledge. And I'm looking forward to meeting you one day in
I
person.
know, right? Person face to face.
Yes, yes.